New York Governor Kathy Hochul vetoes bill to fight deadly fentanyl scourge. With the deadly crisis of fentanyl-related overdose deaths fast becoming a scourge in the U.S., New York City Governor Kathy Hochul has vetoed a bipartisan bill aimed at fighting the problem. The measure, unanimously approved by both the state assembly and the Senate in the spring, but left in the Democratic governor's drawer as she ran for election, will create a 16-member fentanyl abuse and overdose prevention task force to consult with experts and issue a report within a year to bolster New York's efforts to address the addictive scourge, both in terms of enforcement and treatment. Staten Island District Attorney Mike McCowan and lawmakers ripped Hochul on Wednesday for spiking the legislation. Frustrated and confused why Governor Kathy Hochul vetoed this bill, more New Yorkers are dying from overdose than ever. This bill would have brought stakeholders together to implement real solutions, tweeted McCowan, a Democrat who is first vice president of the NYS District Attorneys Association. We will continue our fight to hold drug dealers accountable, helping those battling addiction. To underscore the point, McCowan noted that fentanyl accounts for 80% of overdose deaths in the borough. The bipartisan measure was pushed by State Senate Deanne Savino and Assemblyman Michael Cusick, both Democrats, and co-sponsored by Republican Assemblymen Michael Riley and Michael Tanusis. We are disappointed with the veto of our fentanyl task force bill, but are confident that the governor understands the gravity of this issue and that it will be addressed next session. Savino and Cusick said in a joint statement. O'Reilly and Tassanusis said in a tweeted statement that Hochul's veto is yet another one of her infamous bold-faced dismissals of public opinion when it comes to the matter weighed by state lawmakers in Albany. What we are witnessing in New York right now is a public health emergency unlike any other. Yet the only emergencies that Kathy Hochul seems focused on are those that are self-proclaimed and politically expedient. Hochul, in a series of veto messages last week, said the fentanyl fighting bill was one of 39 measures that would have created task forces and commissions costing about $40 million. That was not accounted for in the state budget. Politicians often use such panels as a dodge when they don't have immediate fixes to problems, but the lawmakers said that fentanyl task force is an earnest attempt to craft a more comprehensive solution to the crisis. None of these costs are accounted for in the state financial plan, Hochul wrote. With appropriate funding, these unbudgeted costs would create significant staffing and other problematic burdens on state agencies. Hochul spokesman Avi Small responded, as one of the millions of Americans who has lost a loved one to the opioid epidemic, Governor Hochul has a deep personal commitment to fighting the crisis and will continue her administration's ongoing efforts to address overdoses and addiction. The governor recently vetoed dozens of bills that would have cost taxpayers $40 million in unbudgeted costs, and we are committed to working with the legislature on ways to crack down on fentanyl and protect New Yorkers. State commissioners of health, mental health, addiction services, and reps from the DAs and state police will serve on the panel along with appointees selected by the governor and legislative leaders. In their bill memo, Savino and Cusick said that while pharmaceutical fentanyl is a synthetic opioid dispensed for treatment of severe pain, mostly fentanyl overdose deaths are related to the opioids mixed with heroin and cocaine, often without the user's knowledge. They also emphasize that deadly amounts of fentanyl are often added to other counterfeit pills being sold as Xanax or oxycodone. These illegally made drugs are sold on the drug market relatively cheaply, which is why so many individuals with a substance use disorder can afford these drugs. Overdose deaths involving these synthetic opioids has increased at an alarming rate. The pandemic has further exacerbated the situation, and through naloxone, which can overturn an overdose if caught in time, the overdose deaths continue to rise, the lawmaker said.